Hi, Robin. I'm sorry to hear that you're not feeling well. After looking at your systems and test results, we have come to the conclusion that you're suffering from rheumatoid heart disease, or RHD. RHD is a complication from rheumatoid fever, which you probably suffer from as a 10-year-old. Rheumatoid fever is linked to a strep throat, and your symptoms of fever and sore joints indicates that you've had this disease. You also mentioned that you took antibiotics, which is used in cases of strep throat. RHD is permanent heart damage that usually occurs 10 to 20 years after rheumatoid fever. It is when one or more of your heart valves are damaged and typically involves the mitral valve. The heart becomes inflamed and can no longer function properly. The heart valves can remain stretched or scarred, and so blood cannot flow properly. Many of your symptoms overlap with the symptoms of RHD. At your physical examination, you had a slight fever. You spoke about having heart palpitations, which showed up in your electrocardiograph, and also spoke to us about some fatigue. Your cardiovascular exam showed mitral valve damage and an enlarged heart. All of these symptoms show up in the patients with RHD. RHD is also the most common acquired heart disease in Fiji children, making it more likely for you to have this disease. Some complications that can occur if left untreated is serious valve damage, and heart conditions like heart failure. Rheumatoid heart disease is a very serious health issue, but can be treated with valve replacement surgery and lifestyle changes. I know that surgery is intimidating and can be especially risky for patients with the treatment restrictions. I understand you have as a Jehovah's Witness, however, there are minimal invasive options that do not require open heart surgery. It's very important that we reduce the stress on your heart, and the first step is to replace or repair the mitral valve that is malfunctioning because of your childhood rheumatoid fever. I would love to have a discussion about your specific religiously informed medical decisions. But as I understand these at the moment, I have some suggestions for the course of actions we should take to relieve your symptoms and support healthy heart functions. There have been many successful heart surgeries performed without the use of autologous or homologous blood, and the critical techniques are to prepare you properly to make sure your body is the healthiest that it can be before surgery, and to use surgical methods that reduce blood during the surgery, using a technique called cardiopulmonary bypass, which means this procedure is high risk, but without it, your heart will not be able to support your body, and you could possibly die. Even with this valve replacement surgery, there will still be steps we need to take to alleviate stress on your heart. This means losing weight through a healthier, plant-wise diet and exercise plan so that your heart doesn't have to work as hard to pump blood through your body. It's important that the whole family supports you in your recovery and that you take it easy following your surgery, which means no rugby coaching for a while. Your job is probably fairly stressful considering you are a restaurant supervisor, and if it makes sense financially and in terms of healthcare, I suggest that you take some time off to avoid these stressful situations and let your heart recover. I know that this is a lot to take in, and I'm available for any questions, but for now, I suggest that we get you started on an iron and vitamin C rich diet to strengthen your hemoglobins in preparation for surgery.